Hi everyone, this is Alexander Lim and welcome to AuthorStory, where on every episode we speak to a different author on a particular topic of interest. On today's episode is Dr. Michael Scheeringa, who is a child and adolescent psychiatrist and associate professor of clinical pediatrics at the Tulane University School of Medicine. He works with childhood trauma and has developed and validated one of the few diagnostic assessment interviews for young children, the Diagnostic Infant and Preschool Assessment, DIPA. He has also validated the Cognitive Behavioral Therapy, CBT manual, which is called Preschool PTSD Treatment to treat preschool children with PTSD. His book, which we're going to be talking about this episode, is They'll Never Be the Same, A Parent's Guide to PTSD in Youth, and you can check it right now by clicking the Amazon link in the video description below. So, Michael, welcome. It's great to have you with us in Author Story.
Thank you. Thank you for having me.
You're welcome. So, Michael, first off, what got you started into investigating PTSD in children?
Well, when I was a young doctor coming out of training 23 years ago, I was really interested in child abuse and trying to prevent child abuse, and realized pretty quickly that it was a little too grandiose and ambitious to tackle. So one of the best next things to think about as a researcher was the effect of children on maltreatment and trauma, which would be primarily post-traumatic stress disorder.
Right.
So we started examining that, and I was interested in the youngest children. So my first studies were on very young preschool children, and we looked at the diagnostic criteria of PTSD, and then it's expanded from there.
Okay. So what made you decide to write They'll Never Be the Same?
Well, I've been going along doing all this research on PTSD in children and doing clinical work and doing lectures at conferences to my colleagues and training workshops all over the world. And I just wasn't satisfied with the pace at which important information was getting from clinicians to the consumers. The consumers weren't learning about, how to detect PTSD very well. They weren't getting good evidence-based treatments. And I realized that going through clinicians to trickle down to consumers was just too slow and wasn't working. So I decided I'm going to write a book and go straight to the parents.
Right. And that way the parents will be able to read about this and they'll be able to identify PTSD in their kids. Is correct?
Correct.
Okay, got that. So let's get a little bit into the subject itself, PTSD, or post-traumatic stress disorder. Yeah. So now, I mean, kids get into a lot of accidents all the time, like falling down, scraping knees, and so on and so forth. But PTSD is a totally different animal, is it not?
It is. It's kind of strange, I know, to talk about PTSD with children. We're used to talking about soldiers coming home from combat and things like that. But actually, children, so what we're talking about is life-threatening kinds of experiences. These are the things that cause PTSD. They're usually sudden, unexpected, sheer moments of panic for your life. These can be things like physical abuse, sexual abuse, witnessing domestic violence, motor vehicle accidents. For young children, attacks by dogs fall into that category, natural disasters, and then for older kids, sometimes even things like school shootings and community violence.
Right. So, I mean, this is, I'd just like to point out that, it's June 2018, and this could be a hot button topic with what's going on the southern borders of the United States right now.
Right, with the separation of parents from their children. Is that what you're referring to?
Yeah.
Right, so that potentially could be traumatic to children. That's an important point, is what's the distinction between a life-threatening trauma that could lead to PTSD and what is stressful. It's a bad thing to happen, but it's not likely to lead to PTSD. So, and this happens a lot in child welfare already in our country when children are removed from their parents because of investigations of child abuse. Very similar.
Okay.
So usually being separated from your parents is not life-threatening. It's a bad thing. It's not a good thing. But it's unlikely to lead to PTSD unless it's done in a way where, because the child is young, or it was done in a very frightening way, that the child feared for their life or feared for their parents' life.
Okay, so you mentioned a distinction there between a stressful event and a life-threatening event. I mean, how can a parent say distinguish between the two where their kid is concerned?
Well, it's has to be in there was a danger that someone was going to be seriously physically injured
Mm-hmm.
or killed.
Mm-hmm.
So I think just thinking of it in that kind of black and white, that type of level of physical injury and death, there has to be that level of threat involved in it.
Okay, and it may not actually be an actual life-threatening thing. Like, I mean, I'm thinking like a kid who might be bullied, but by another kid or someone with a knife, and he thinks he might be killed, but that person might not have any intention of using that knife whatsoever. I mean, there's that, isn't it?
That Yeah, Alex, that's a great example. Most bullying is probably not life-threatening, but
Yes.
if it did rise to that level,
Hmm.
where in the eye of the beholder, the child perceived that, that they might be killed, then it could be. So it kind of you have to take each one case by case and walk through exactly what the child perceived.
Right. So this is kind of an individual thing. I mean, like one child might perceive an event to not be life-threatening, while another child might perceive the same event to be life-threatening. So it's really up to how the individual child perceives it.
Exactly. It could be two people riding in the same car that are in the same car accident,
Right.
and one of them perceived it as life-threatening and the other one didn't. Yeah.
Okay. So that's that complicates things a little.
Yes.
All right. So, as you probably guess, I'm not that familiar with PTSD. I mean, but I'm sure there are myths surrounding PTSD that might not apply to kids. Like what you mentioned, like we know about soldiers getting PTSD. What are some of the things that we quote all know unquote, which are actually myths surrounding childhood PTSD?
Well, there's several. We could take one is one of the myths has been young children don't remember what happened to them.
Hmm.
That has been a myth. You know, we've recognized PTSD in combat soldiers and in older children, but it's been slower for people to accept that young children could even remember. I give a story in my book of one where a neighbor of mine learned that I was doing research on PTSD in preschool children, and made a point of telling me he didn't think young children could remember
Hmm.
trauma, and they can't develop PTSD, but they can. I mean, if everybody thinks back to your own life, the earliest event you can remember is probably when you were 4 or 5.
Hmm.
And it was probably a bad thing, a stressful thing.
Hmm.
So we know as young as 3 years of age, children can develop PTSD.
Wow. Okay. And how do kids manifest PTSD?
On the big picture, if a parent sees any sudden change in their child's behavior, they should be suspicious after some kind of life-threatening event, because PTSD is just about the only psychiatric disorder that starts immediately. Like one day you didn't have it, the next day you do. There's almost no other psychiatric disorder like that. But more specifically, there's 20 different symptoms in the official diagnostic criteria for PTSD, and we divide those up into 3 different types that parents can look for.
All right.
The first type are what we call the re-experiencing. Those are things like nightmares or intrusive thoughts that barge into a person's head that they don't want there. The second type we call the avoidance and numbing symptoms. These are things like losing interest in things that they used to like to do or withdrawing from their loved ones. And then the third type we call the increased arousal symptoms, like difficulty concentrating, difficulty sleeping, and exaggerated startle responses.
Okay, okay. So, I mean, kids then do get PTSD, but now this may be a myth, correct me if I'm wrong, but can kids grow out of it?
No, I can
Okay.
give a pretty flat answer. And that's one of the big messages. And one of the big reasons I wrote the book is if children have symptoms of PTSD after 1 month
Hmm.
following their trauma, the symptoms are very unlikely to go away on their own. These are not like bruises that just go away with time. And so there's so many cases I give in the book where parents waited 7 years,
Wow.
3 years before getting their children any help, just thinking, well, it's got to get better with time. And it doesn't. After 1 month, it's time to get professional help.
Right. So PTSD in kids, this is, it occurs to me, this is as serious a concern for kids as is if it occurs in an adult and a grown-up.
It is. It can impair their ability to function. Their grades drop. They withdraw from their friends. They can even become suicidal. There's a case in the book of a couple kids who became suicidal because they just couldn't stand living with this loss of control that they felt.
Okay. Would you mind giving us a short précis of one of these cases? Just so our listeners have an idea, a solid idea of how this can affect kids.
Yes. So let me start with a teenage girl who was sexually assaulted in a parking lot by an assailant. And she was 14 years old. Then the assailant assaulted her, raped her, and then did the usual thing that these assailants do. Says, if you tell anybody, I'm going to kill you, and I'm going to kill your family.
Right.
And that is probably the most frightening thing. Afterwards, she had intrusive thoughts that she could not stop thinking about this. So she would do just about anything to distract herself. She would go to parties. She would have sex with people she didn't normally would have, just to take her mind off the pain of the memories. She withdrew from her family. Her grades dropped. And the worst thing is that she felt like she was never going to be the same again. And that's kind of where we get the title of the book, They'll Never Be the Same.
Right.
She was struggling to live with what we call the new normal. She couldn't talk to her friends at the lunch table at school about it because they'd never been through something as horrible as that.
Right.
She felt totally alone and had no one to talk to about these things.
Okay. And so what eventually happened to her? I'm just curious. Was she helped out?
She was enrolled in one of my studies, and we treated her with cognitive behavioral therapy, or CBT.
Okay.
And she eventually was able to talk with the therapist about her experiences, as painful as that was. And we can talk about, what is CBT for parents so they know what this best kind of therapy is. And she eventually got significantly better. Now, she never got totally cured of all her symptoms. And that's another one of the messages of the book is that there really isn't total cures for these kinds of things. It's kind of like living with diabetes or chronic back pain. It's kind of learning to live with the new normal.
Right. Okay. So you mentioned CBT, cognitive behavioral therapy. What is this all about?
Well, parents need to know that there are different types of psychotherapy for PTSD.
Okay.
And we have what we call evidence-based treatments. And that means that they have been tested in a randomized clinical trial and shown to work. And there's lots of other things therapists do that have not been tested like that, but they claim it works, or they just like doing that kind of therapy. But cognitive behavioral therapy is one of the best tested for treating PTSD. So it's usually a course of 12 to 15 sessions that are spaced weekly. It starts out with having the person learn new coping strategies like slow breathing exercises or muscle relaxation or guided mental imagery as new coping skills. And then they have to start talking about their trauma. It's kind of like the no pain, no gain philosophy is, unfortunately, you have to revisit those memories. And it's done in a gentle, guided way. And as they get anxious talking about it, then they use their new coping skills that they've learned and gradually get mastery over those negative feelings that are connected to the memories.
Right. And this takes 12 to 15 weeks. It's not that long when you consider they can manage the situation for the rest of their life. I mean, it's worth it.
Right. It may sound a long time at first, but when you consider the alternative of living for 7 years,
Yes.
before getting any help. And it's also important to point out that psychotherapy is the first line treatment. It's not medication. It's this kind of psychotherapy that has the best long lasting effect.
Right. Okay. Now let me ask you something a little bit about the parents, because I mean, uh, this PTSD in kids, as you said, it's not thoroughly understood. And I mean, people always have a tendency to blame the parent, particularly blame the mom. And I'm sure a parent is not going to like to feel blamed, and that this might hinder their search for a cure for their kid.
Right. That's one of the other myths, the things that, like you said, everybody thinks they know, is that we can blame parents when things go badly for their children. And I devote 2 whole chapters to that in the book. I mean, you can imagine if you're a parent and you have done everything in your life to raise this precious child of yours, and you take them to a therapist, and the child may not be getting better because it's a complicated case, and then the therapist starts hinting and suggesting that maybe your parenting is to blame for their child's PTSD. I mean, that is almost nauseating for a parent to sit there and be blamed for things like that.
Yeah.
And the evidence just isn't there. Our field has had a terrible history of blaming mothers. In the 1950s, we blamed mothers for autism, and now we know that's wrong. In the 1960s, we blamed mothers for schizophrenia. We now know that's wrong. And it's just this fallacy that our culture wants to blame mothers, and now it finds a home with PTSD. And parents need to realize that they don't cause their children's symptoms.
Right. But I'm sure, I'm sure you can't. From my point of view, I mean, I'm sure you can't really blame some doctors. I mean, some parents. I mean, they might lie about their children's symptoms, what their children are experiencing, maybe to gain some attention or stuff like that. Do you think this might factor into the lack of awareness or the lack of proper diagnosis for kids with PTSD?
It could. I think that's one of the things that unfortunately feeds into the fallacy of blaming the mothers and it kind of goes back to how clinicians are trained, doctors and therapists. We tend to be trained in skewed populations where we see parents who do lie and fabricate. Maybe they want a disability check, or maybe they're something.
Yeah, work the system, game the system.
Right. And we disproportionately see those kinds of cases in our training. And those are the ones we remember. And we don't ever want to be bamboozled again. So we always are on guard for that kind of scenario. But in my experience, I just don't see parents lying to make their children appear more sick than they are.
Okay. So what percentage of people? I mean, I know you've done studies on this. So with all the kids that have undergone your treatments, CBT, yeah, and how many of them have gotten better? How many of them have been helped with their PTSD, with their symptom?
Around 75% tend to get pretty good improvement with their symptoms, marked reduction in the severity. So there is this 25% or so that are difficult to treat for a variety of reasons, and we're working to try to find better treatments for those, and maybe they need extra help with medications and things. But that's the great news. I know the title of my book has a kind of a downer title. The good news is that we really do have good treatment that helps 75% of people.
All right. Well, I mean, 75%. That's a pretty good success rate. I mean, heck, that's better than living a life of fear and whatever it's trapping you in that thing.
Right.
Yeah. Okay. So what can be better done? I mean, I got that things are lacking in insofar as awareness is concerned, and your book is a good way to bring up awareness of this issue. But what else do you think needs to be done for PTSD to be accurately recognized? At least most of the time.
Well, there's a lot that could be done better for training of clinicians, but that the book is really focused on for parents, what parents can do. The message is for parents, it's up to you. The research shows that clinicians actually miss the diagnosis of PTSD 90% of the time.
Wow, that's a
Right.
lot.
Right. And we can talk about the reasons for that. But what parents can do is they can do their own assessments.
Mm-hmm.
They can go, for instance, to my website, and there's lots of other places they can go, but they can download a free questionnaire that they can fill out themselves. If the child is old enough, they can even have their child fill out a child version and kind of do their own assessment. Usually doctors tell patients, I don't want you doing self-diagnosis, but what I'm telling you is I want you to do self-diagnosis.
Okay.
Because for PTSD, that's where the field is at. Parents can get in the game and help with better detection.
Right. So other than checking out those websites and getting questionnaires and essentially self-diagnosing, is there anything else parents can do to help their kid?
Then they need to find the right kind of therapy. Like we were talking about, there's good evidence-based treatments, and those are the ones parents need to look for. And it can take some shopping around. So when they are looking for therapists, they can ask around by word of mouth who does this kind of therapy. When they call a therapist, they can check them out over the phone before they schedule an appointment, asking, have you ever seen a child like mine with PTSD? How many cases have you treated? Have you treated children that are my child's age?
Right.
What kind of psychotherapy do you plan to do?
Right.
And those are kind of tough questions. Some therapists don't always like answering them, but that's what parents can do.
Okay. Well, yeah, definitely. I mean, they have the kids. They got to get the right help, and it's got to be the right person. I mean, I understand that kids don't get along with everyone, so even more so with some therapists, I'm assuming.
Mm-hmm.
Okay.
And that's another thing. If you're in therapy with a certain therapist and it's not going well and you're not happy, you can switch. I know it's a pain to have to switch therapists, but you may have to do some shopping around.
Right. So, let's get a little bit into the biological aspect. Are there any biological effects of PTSD? I mean, like, I don't know if you've done research on this, but have you checked out like what the brain looks like with a child who has not experienced PTSD against a child who has? What do you think about that?
We have done research on their sympathetic nervous system reactivity. I haven't done brain imaging myself,
Right.
but in the book, I devote a whole chapter to reviewing the neurobiological evidence. And that's another one of the myths that everybody thinks they know. That the current belief out there among experts is that trauma damages the brain.
Okay.
And that's wrong. I'm in a minority opinion, but the reason people believe that is that it's based on what we call cross-sectional studies, where people have done brain imaging after the traumatic event. So they don't know what the brain looked like before the traumatic event.
Right.
And they jump to conclusions that, trauma must have damaged the person's brain because that's a catchy narrative. That's a super scary story that gets attention.
Right.
But newer research, there's now about a dozen studies that have studied people before they were traumatized, which are really hard to do when you think about it.
Right.
You have to study like police recruits and soldiers before they're deployed.
Right.
And they are finding 100% of the time that those brain differences were there before the traumatic events. And those brain differences probably explain why those people were vulnerable to develop PTSD. It's not that trauma caused those brain differences.
I see. So it's something like there is a physical I don't know, an increased chance of these particular people with these particular concerns getting PTSD compared to others?
Exactly. They have a vulnerability. For example, we focus on the amygdala and the prefrontal cortex. And those are the centers in the brain that process threats from the environment. And in certain people, those areas are overreactive. You can think of people in your own life who kind of overreact to minor annoyances.
Right.
Then those are the people who are vulnerable to develop PTSD after a traumatic event because their brains were different, probably because just of genetics than how they were born.
Right. Hence, possibly also an explanation for why the same event could be traumatic to one kid and not traumatic to another kid.
Exactly.
Interesting. Interesting. Okay, cool. So, Michael, let's say you came across someone, an adult, who knows of a child who most likely has PTSD, wants help, and you only have time enough to tell that person one thing. What would be that one thing you tell that person?
It's up to you to help get the right diagnosis and find the right treatment. You can be involved in doing self-assessment and shopping around for the right kind of treatment. And unfortunately, you can't just trust that you're going to go to anybody who knows what they're doing. The parents, it's up to you.
Okay, okay, cool. So, Michael, so it's a lot of information, and it's really given a different, it's really shown up a light on what PTSD in kids is like. So, in the last minute or so of this interview, are there any last words of wisdom you'd like to share with our listeners?
I think to be, despite the kind of the negative implications of the state of things, and that trauma has kind of long-lasting, almost permanent effects, that there is good news, that we do have good treatments. If you get the right kind of treatment, people can live very, very, very productive, happy lives with getting the right kind of therapy. And this book should help them find that.
All right. So, in other words, it's not like it's all gloom. Yeah, gloom and doom. I mean, there is something beyond that.
Right.
Okay. All right, so thanks, Michael. So in closing then, the book is They'll Never Be the Same, A Parent's Guide to PTSD in Youth. The authors are guest, Dr. Michael Scheeringa. So, Michael, thanks a lot for the information. Thanks a lot for sharing your message. I think it's an important one, and I believe it should get out. And thanks for being an author story.
You're welcome. It was a pleasure talking with you.
Cool. So, everyone, I invite you to check out They'll Never Be the Same. And of course, please feel free to subscribe to our channel. So I'll catch you all next time on Author Story Weekly Interviews with another amazing topic and another amazing author.